Life is so wonderful. Only until annual health checkup, I got ultimate shock of my life. Diabetes? Destiny, it seems, had vision of me in a hospital. It's my doctor who made me see otherwise.
When you read the word diabetes in your health report, there is no need to imagine the worst. Let us understand what diabetes is.
Like engines, our bodies too need fuel. This fuel comes to us in the form of sugar, derived from the food we eat. Our body changes the food we eat into a sugar compound called glucose. To assist our body use this glucose, our pancreas secretes a hormone called insulin. Glucose travels from the stomach through the blood cells, looking for individual cells requiring energy. For glucose to get into the cells, it requires insulin. Insulin is the key which unlocks the doorways into cells, allowing glucose to enter and deliver the energy. Once the insulin arrives, it attaches itself to receptors on the cells, which signal to the cell to activate glucose transporters. These transporters pull glucose through the cell walls. When glucose enters the cell, it delivers energy. As glucose enters the blood vessels, your pancreas matches it with the right amount of insulin. When you have diabetes, the cells develop resistance to insulin. In these cases, the cells are locked and glucose cannot enter. This makes it difficult for the cells to get the energy they need. The pancreatic gland also, over time, does not manufacture enough insulin to help your body absorb all the glucose. Due to insulin resistance or lack of insulin, the glucose cannot enter our cells as the cells are locked. Glucose cannot provide energy where it is needed, and this energy is lost. Thus, when you have diabetes, glucose isn't carried properly to your cells, so too much sugar stays in your bloodstream, causing damage to various important organs in your body.
Diabetes is chronic, lifelong condition that requires careful monitoring and control. If properly managed, you can have an event-free and fruitful life. But yes, if left ignored, diabetes can lead to long-term damage to the body, as well as some further complication like
cardiovascular disease or heart condition, kidney disease, nerve disease which can affect toes, feet and lower limbs, or eye disease which can lead to vision loss.
You know, I wish I had controlled my eating habits and devoted some time in regular exercises. But all is not lost. My doctor told me that I can still control my diabetes.
The primary goal of diabetes therapy is to maintain general health such that you can lead a normal life.
there are different types of tablets or pills that can help to lower your blood sugar. They can help the pancreas to release more insulin, reduce insulin resistance, or reduce the amount of sugar that enters the blood after you have eaten. If you remember, diabetes is caused as your body makes less insulin or if it becomes resistant to insulin. This leads to inefficient utilization of sugar by the body. In both cases, the body needs to be supplied with insulin to keep its blood glucose level within control and prevent serious health complications. Initially, through oral medication and tablets, diabetes can be controlled. But over time, the effect of oral medication may reduce as your pancreas becomes less efficient in producing its own insulin. Therefore, tablets have less insulin to work with to reduce your blood sugar levels. This is a natural progression for diabetes and absolutely no cause for alarm. There is a solution for this. Your body now needs insulin from outside.
When I heard that I had to start insulin injections, I feared the worst. It was really very unwelcome news. But you know what? That fear was very much unfounded and had clouded my judgment. As I spoke to the doctor and few other people, I realized the misconception in our minds about insulin.
If your doctor tells you that you need insulin therapy in order to control a diabetes, that does not mean you are doing anything wrong or your condition is getting worse.
But why do we need to start insulins? Does it mean that we have failed to manage diabetes well and my diabetes is getting worse?
Nothing like that. Diabetes in itself is a progressive disease, and eventually your pancreas are just not able to keep up with your body's requirement for insulin. And insulin helps you to manage it better.
If I begin to take insulins, I will have to take it for life.
For people with type 1 diabetes, this is true. For some people with type 2 diabetes, depending on the stage of the disease, insulin therapy may be a temporary treatment, and that is only necessary during period of illness and other stress.
But the injections are really painful.
Although no one likes shots, most people are surprised by how little an insulin injection hurts. Insulin does not sting going in, and the needles are very small and thin.
Once I start taking insulin, my life is going to change, maybe for the worse.
Many people believe that once they start insulin, they can no longer be independent, live alone, travel, or eat away from home. None of this is true. After starting insulin, many people wonder why they waited so long to feel better.
Then maybe taking insulin can cure my diabetes.
No, don't mislead yourself. Currently, there is no cure for diabetes, but insulin helps you control and manage it. It will ensure your body remains healthy. Remember, insulin is a natural hormone that your body needs. So it's not habit forming or addictive. Without it, your body cannot normally control the blood glucose levels. Let us now see how to take insulin. There are various types of insulin available. Your doctor is your best guide to advise which type you should take.
Taking insulin through injection is not as difficult as one feels. It looks fearful, but can be safely handled by anyone. Trust me, I do it every day.
It is important you wash your hands thoroughly with soap and water and wipe your hands dry. If the liquid in the vial looks cloudy, roll the vial till it looks uniform. Wipe the rubber cap of the insulin vial with an alcohol swab. Fit the needle onto the plunger and pull the plunger down to fill your syringe with air equal to the dose of insulin you are going to take. Now, push the needle through the center of the rubber top on the insulin vial. Push air into the insulin vial. Do not take the needle out. Turn the insulin vial and syringe upside down. Pull the plunger out slowly to get insulin into the syringe. Be sure to get the correct number of units and check that you have the required units of insulin. There should be no air bubbles. If you have air bubbles, push the insulin back into the vial and start this step again. Pull the syringe out of the vial. Now, where do we inject this insulin? Inject Insunova in the areas as shown in the figure for 1 to 2 weeks. Each time you inject, make sure you inject in a different spot. You must rotate the injection sites periodically. Now clean the injection site with an alcohol swab and let the alcohol dry completely before you inject. Pick up the syringe and hold it like a pencil. Do not let the needle touch anything. Then pinch your skin. Prick the pinched skin with the needle and push the plunger to inject Insunova. Pull the syringe out of your skin. With your finger, press the alcohol swab over the spot you have injected and dispose the syringe properly.
Please remember that you need to take care of this insulin and its vial. If insulin is not properly kept or handled, it will become useless and will not cause the desired effect.
To keep insulin in good condition, you must do the following. Store it between 2 and 8 degrees Celsius. Keep your extra supply of insulin in the refrigerator. Never let your insulin freeze. The vial you are currently using should also be kept in the refrigerator as far as possible. Keep away from heat and light. Never shake your insulin hard or let it get tossed around. Insulin that's handled roughly is more likely to clump or frost. If you are traveling, there are travel kits for insulin which ensure insulin is kept at the right temperature and in the right conditions.
Although diabetes is a serious condition, but with care and proper guidance, you can definitely control it.
As far as injecting insulin is concerned, as you have seen, it is a very simple procedure.
So don't worry excessively. You can definitely look forward to a fruitful life ahead.
This patient education film was brought to you by Mega Life Sciences Limited.